Hello, everybody. We're going to go ahead and get started shortly. I'm going to go ahead and give it about a minute before we can start. I see folks are still trickling, and we're going to go ahead and get started shortly, but welcome everybody. All righty, so the time is 1:02 Eastern, 1:02 Central Time, my apologies, 2:02 Eastern Time. I wanted to welcome you all to today's webinar. Just for introduction's sake, if you all, I see folks are doing it in the chat already, but if you want, go ahead and introduce yourselves by placing your name, the organization by which you work at, as well as your role. But again, I want to welcome everybody to today's webinar. For folks who don't know me, my name is Mark Lockwood, and I'm the program manager here at AIDS United. And we're really excited to be introducing this component of the SSP TA Center. And today's session is titled, What Can Data Do For You? Which will focus on grant reporting, data management, and evaluation, often referred to as M&E. Today's session is the second of the Building a Sustainable Future for Harm Reduction funding series, and will be presented by our colleagues at Supporting Harm Reduction Programs, also known as SHARP, at the University of Washington, as well as our colleagues at NACCHO. So just a little bit of ground rules. Be advised that today's webinar is recorded and has closed capture features. We ask that for folks that are on today's call to please keep your lines muted during the duration of the call. And if you have any questions throughout the presentation, be sure to use the Q&A option down below, or you can wait until the end where we actually will open it up for Q&A. Additionally, after today's webinar, all the PDF version of the slide deck will be sent out alongside an evaluation for feedback, as well as other related resources that will be talked and discussed throughout today's presentation. Next slide, please. So here, I mentioned that this is a part of the Building a Sustainable Future for Harm Reduction funding series. And this is just the outline of the funding series, and it occurs bi-weekly, as you all know, from 2 to 3:30 Eastern Time. So the next date that we have on the calendar is for July 20th, and it is titled Notes from the Field, Grantees Funding Diversity and Sustainability. And we'll explore how SSPs have developed unique programming to support participants in creative and innovative ways. This session in particular will highlight current strategies and perspectives from harm reduction programs, providing insight into how they've been able to leverage diverse funding streams for program implementation and service provision. Panelists on that during that session will also discuss braided funding models, navigating the harm reduction landscape, as well as discussing creative collaborations across jurisdictions. And that is for July 20th. And then the one that we have dated for Wednesday, August 3rd, that one will explore how SSPs can develop a competitive, well-developed grant application, and we'll hear directly from funders themselves. We have NASDAD, our colleagues at NASDAD that'll be on that panel, as well as the Comer Foundation, the National Harm Reduction Coalition, as well as here at AIDS United. This session will highlight the current federal and nonprofit funding trends to assist programs in navigating the harm reduction funding landscape. And this will be a space where participants can hear directly from funders on how to capture evaluation criteria, key aspects of the RFP, strategies to diversify nonprofit funding, and then how to build and sustain harm reduction funding programs. If you have not done so, I really urge you all to register for the final 2 webinars and really circulate them alongside your colleagues within your network as well. The registration link will be placed in the chat throughout today's session, and also it'll be sent out via email moving forward. Next slide, please. So here is the AU team. So AIDS United's mission is to end the AIDS epidemic in the United States. And we seek to fulfill this mission through strategic grant making, capacity building, policy and advocacy, technical assistance, and formative research. So throughout our harm reduction portfolio, AIDS United engages in grant making, technical assistance, and advocacy to reduce the health, psychosocial, and social economic disparities experienced by people who use drugs. Our harm reduction grants and initiatives support evidence-based and community-driven approaches to prevent the transmission of both HIV and viral hepatitis, reduce injection-related injuries, increase overdose prevention and reversal efforts, and connect people who use drugs to comprehensive prevention, treatment, and supportive services. Our team brings together over 20 years of experience in harm reduction and draws from a background across many things. So from lived experience, from research, philanthropy and grant making, direct services, capacity building, and policy, both in governmental public health and nonprofit spaces. Next slide. Here is the SHARP team. So the Supporting Harm Reduction Programs team at the University of Washington leads the monitoring and evaluation portfolio of the National Harm Reduction TA Center. So we at AU would like to thank the SHARP team for their eagerness and collaboration on this series. And today we actually have 2 presenters from the SHARP team, Kelly Knutson and Sarah Deutsch. So Kelly Knutson is a TA provider and project manager for the monitoring and evaluation portion of the TA Center. Kelly started working in harm reduction in 2007 and has spent over a decade working on the monitoring and evaluation of health programs. Thank you, Kelly, for being here, and I'm gonna toss it over to you shortly. We also have Sarah Deutsch here. So Sarah Deutsch is a TA provider with the SHARP team who has more than a decade of experience with SSP operation as well as experience as a funder. And we're also excited to have you here as well, Sarah. Next slide, please. We at AU would also like to thank our partners at the National Association of County and City Health Officials, which is also known as NACHO, for collaborating with us on this session as well. Today, we're welcoming Kat Kelly here as a presenter. Kat Kelly is the Senior Program Analyst on the HIV, STI, and Viral Hepatitis team at NACHO. And in this role, she provides technical assistance to local health departments and SSPs to support harm reduction efforts and the integration of harm reduction, hepatitis, and sexual health services. Again, we're so excited to have you all here today to present on data monitoring and evaluation. And now I'm actually going to toss it over to you all. So thank you all so much. And I hope that our participants, that you all enjoyed today's presentation. Thank you.
Thank you so much for these introductions, Mark. So as Mark mentioned, my name is Sarah Deutsch, and I'm a TA provider with the National Harm Reduction TA Center. Excited to see some familiar names on here. And I'll be starting us out today with a discussion of how to use data in grant applications. So we'll be going through some tangible examples and then data sources as well to write statements of need. Kat will lead us through an explanation of evaluation plans and frameworks for writing evaluation plans. And then we'll close out with Kelly reviewing common data systems in relationship to deliverable tracking and grant reporting. Next slide. And I apologize if I ever forget to tell Kat to advance a slide, but I will do my best. So during the first webinar, Amanda and Angel did a great job of kind of highlighting how grant sections might require M&E, but today I just wanted to dig a little deeper on the following sections. So we'll touch on the organizational overview, which I encourage people to think of as kind of the resume of a grant application, which means that you can write it in advance and update as you go. We always tell folks that they can pre-write this and then kind of highlight sections that they'll want to update as things change for their program, kind of in a plug and play manner. And then a statement of need, which to some extent can also be written in advance for certain types of grants. And again, you can kind of think of this as plug and play. If significant events occur in your community, you might want to add that into your statement of need. So a simple example would be, let's say in your community, a major treatment facility closes down. That might impact your participants, and you want to insert that in your statement of need. And then with your project plan and evaluation plan, these are obviously going to need to be tailored to each grant application. However, you can upcycle project plans and even evaluation plans when you might not be awarded a grant in a given cycle. And I can't remember if Amanda and Angel touched on this already, but even if they did, it's worth repeating that you can talk to funders if you weren't awarded a grant about what the reasons for that may have been, and then go in and update your project plan and evaluation plan right then and there. And that'll help you when you are searching for grants that can fund that project that you might think is really, really essential to your program participants. Next slide. So what funders may be looking for from your data, and I'm not currently a funder, so that's the disclaimer here, but have been before, and just want to share some of the key aspects that they might be looking for. And of course, there are scoring rubrics that hopefully most funders will include some like kind of leads for you to think about, but these are rules of thumb. So the rationale for your project is your proposal based in a demonstrated need. And to some extent, you'll always want to root that just for good organizational management and your participant identified needs. So are you driven by what your participants are telling you? Your demonstration of your impact. So is your proposal going to help you address the need that you've already outlined? And with that, you'll want to consider your historical services and the way that you have already demonstrated what you can attain through what you deliver. And then kind of target, this may be a target population, but it may be the target services that the grant has outlined. So is your proposal focused on serving the population that the grant is focused on, and is it aligned with the requirements? So, you know, if you're applying for a grant that's focused on sexually transmitted infections, make sure that you're including information about the prevalence in your community or among your participants, and not just focusing on HIV and hepatitis C. And then lastly, achievability. So they're going to be looking at whether there's sufficient infrastructure to accomplish and measure the project. So including information about existing staff capacity, how many staff you'll be bringing on, and on what timeline will be really important as well. Next slide. All right, so I'm going to touch on 3 types of organizational data. And just a warning, there's a lot of kind of text on the next few slides. I'm not going to read it all, but I do want everyone to know that there's that as a resource for you. As Mark said, these slides will be sent out, and we've included some examples of how to talk about data because we've heard that it's really important for programs to model things off of what we know works. So we'll discuss program data, which is about kind of what your organizational operations look like, and service data, what your activities and service model are, and your participants, what is your community profile. And then, like I said, some of the examples will be showing you kind of what it looks like to communicate your data in a way that, or in a language that funders understand and what they speak. So starting off with that program data piece. So thank you, Kat, for reading my mind. So here we've kind of outlined 5 possible data points that you might include. You might not necessarily hit all of these data points in every single grant application. And in fact, you might have lots of other ones that you think are important. But these are kind of key ones. So in addition to these, and I'll kind of give you some opportunities to think through this as well, you're thinking about how you're going to kind of highlight achievements. You're thinking about telling stories about how you've grown, how you're going to be delivering the services that we'll talk about in the next section. So talking about your personnel, a lot of funders at this point are really interested in what your hiring practices look like, and how your staff may or may not reflect your community. So they may be interested in the demographics of your staff, and where you might be collecting information like that might be in your onboarding documentation, but you might also want to consider distributing a staff survey at a regular interval in case things change. So for example, staff gender, if you do an onboarding survey, that won't necessarily be reflected unless you collect that information on a regular basis. If the grant is specific to a certain service, you might want to focus your FTE on specific types of positions or roles. So really drilling down, we have this many outreach workers, we have this many case management staff. Catchment area is kind of a combination between program data and community data, which we'll get into later. So this is a little bit more than the geographical area that your program will serve. It's also who your program will serve. So you might define it by site locations and the availability of your services, but that's not necessarily the whole picture if that's not where your clients live or stay. So you may use data that you've collected on on zip code or county of residence for your participants to illustrate your reach. Budget can be really tricky. I always recommend that SSPs have a general estimate of how much they're spending on operating their actual syringe services program. But even that can be tough, right? Because if you offer HIV testing, if you offer HCV testing for that matter, like, are you including that in your budget? And you'll want to look at, again, funder requirements for this. But if you're a grant writer, if you're a program manager, talk to each other about how you want to measure this and how you want to update it for your future projections. And then again, touching on that storytelling piece, talking about how your program came to be, when it came to be, and how services rolled out, especially if it's in relation to program or participant requests, that can be really important. And noting here that that a lot of that stuff comes from historical knowledge. So making sure that your staff are writing things down, like when did we officially start our SSP? Make sure you know where that's stored. Next slide. For each of the data points that I just kind of articulated, I've included some example statements for you. And then I've just highlighted one that I think is really important. And then that'll be repeated, this kind of format throughout. So here, catchment area, I mentioned that you could include lots of different data points to explain this. So the sentence that I just wanted to share with you is we provide services in zip codes 1, 2, 3, 4, 5 and 2, 3, 4, 5, 6, which are the urban hub of our region. We see participants who live in these zip codes and surrounding ones, 3, 4, 5, 6, 7, 4, 5, 6, 7, 8, 5, 6, 7, 8, 9, which are more rural. Some participants report traveling over an hour to access our services. So here you're using some anecdotal information, some encounter level information, and then also some program data about like when you're open and where. Next slide. Common examples of service data, and most SSPs that I have had the pleasure of knowing have some form of these data points. And so I see these included in almost every statement of need, where you'll include a number of SSP encounters, which can be tracked both on the aggregate session level or by individually capturing each encounter. So some programs might say, we had 100 encounters during this one session, but not individually talk about each encounter, and some might. Syringes in and out, so obviously returned and distributed. By site, if it's applicable, that could be especially interesting to look at, like whether you're distributing more in certain areas, and especially if grants are focused on certain areas, this can come in handy. And then if relevant, testing, naloxone distribution, and again, these can be aggregate numbers or by session, or by encounter, excuse me. Next slide. So the one that I wanted to highlight here is that depending on how you want to talk about your data, there are different ways that you could talk about your syringe distribution and collection. So you could say our SSP distributed 1,200,000 syringes in 2020. And then drilling deeper, say 800,000 of these were distributed at our fixed site, and maybe then get further into where the rest of the 400,000 were distributed. Or you could frame it in a percentage. So some programs, this can be really touchy, right? So they might not want to say how many syringes were returned, because they're concerned that it might reflect poorly on them, and they might instead say 95% of our encounters included returned syringes. Next slide. Participant data. So a lot of participant data is specific to programs that collect unique participant IDs. However, a personal favorite of the University of Washington SHARP team is point-in-time surveys, and these can be used as proxies for unique counts. So usually unique participants, if grants ask for a number of folks served, are collected from intake information or number of codes that a program has. And I'll get a little bit more into missing data later, but there are certain ways that you can estimate this. You just need to be sure that the funder will allow you to estimate the number of unique folks served. And that could be estimated based off of certain service data or point-in-time survey data as well. Same goes for demographics and housing status, although there's actually also a third option. Some programs on the encounter level, if they don't collect unique IDs, will still ask certain questions at each encounter. So age, race, gender, or housing status. But in that case, rather than the denominator being unique participants, the denominator would be total number of encounters. So that's a little bit less specific. Next slide. The one I wanted to highlight here is housing status, because there are a couple of different ways that programs might be able to report on this. I suppose I kind of jumped the gun on this from the previous slide. But if you're collecting it based on intake data, then you can say 30%, 35% of our SSP participants reported living outdoors. But if you're collecting it at an encounter, you would say 35% of our encounters at our SSP were with people who reported living outdoors. Next slide. And calculating participant data, if you are collecting uniques, many programs choose to use some kind of universal or blanket code for folks who don't have, who have chosen not to complete an intake for one reason or another. So maybe they'll enter them as a 99999. And then every single person who has no intake would be counted in that way. If you include the blanket code in your calculation, then you might end up with some problems, because it'll look like with just one individual when in fact it's many. And if your denominator changes, just make sure that you spell that out. It's not a problem necessarily. So you could say something like, of participants for whom data is available, X reported. And that's a really simple workaround for that. Next slide. Our recommendations for all of your data, this goes for program, service, participant, is that it be as current as possible. A lot of folks may choose to use historical data as a comparison to demonstrate their growth. They may also use historical data if something has changed massively. So for example, showing how HCV treatment uptake has been much higher since the availability of DAAs increased, or the lifting of a specialty provider requirement or something like that. And then that it be consistent. So just really stick to whatever date range you decide to use. Most programs will choose a calendar year, the previous calendar year, but if you're applying for a grant in September, sometimes programs might decide, okay, well, let's use a July to June year instead because it's more recent. And then explain gaps. A lot of folks, this may apply to most people on this call, had changes to their services during COVID. So you can feel free to say that, right? From March to 2020 to July 2020, we didn't offer testing services. So this was the year, before, or we're offering, August to June numbers because we don't want to include March to July. And also if you introduced a new service for whatever reason, you could say in the last 6 months rather than a year. Next slide. Starting out a section that you're going to use the same type of data with an explanation of how the data was collected is really helpful to funders, because then they can understand how what it looks like on the ground. So you could say, essentially what I said earlier, either we collect data at every encounter, we collect intake information, or we do a point in time survey. Those are kind of our three examples we stick to most often. Next slide. And be clear about what you're asking your participants. So it's really different to say 40% of new participants during this time period reported being tested for HIV in the last year, from 40% of new participants reported a lifetime HIV test, from 40% of participants receiving HIV testing reported having a previous test ever. And thanks, Kat. Consider using qualitative data when it's available. I think programs have a lot of this stuff often that they don't necessarily consider using in grant applications because they might not see it as hard data, but it can actually be very compelling to funders to know what participants are telling you. So that might look like surveys where you had free text questions. It might look like focus groups or even testimonials. Even if they may not be representative, they could still be really compelling. And the UW team, just a little plug, will have a guide to informal qualitative data collection strategies forthcoming in the next little bit. So a little sneak preview there. Next slide. If you do not have data that a grantor is looking for, I think first and foremost, you need to do some soul searching. Look very closely at the letter of the law, really. If they're asking you to specifically share information on a topic you don't currently have data on, just really ask yourself if it's worth spending your time on it. For example, if a grant is available about serving BIPOC folks, and you do, but you have not collected demographic data ever, you're going to have to think really about how you could demonstrate that. And if you decide that you can't, is it time for you to start integrating that into your routine data collection? And Kelly can talk a little bit more later about what it means to change a system or incorporate that. So if you decide to proceed with the application despite not having the information, be clear if you're estimating, and also be clear about whether you could collect this data in the future. Funders may be receptive if you say, like, this is the reason why we haven't been collecting this information. If we get the grant, we can do it. And we can also offer potentially baseline data. And then lastly, there are situations where you might be able to provide some research findings in lieu of program data, although that may or may not be acceptable to the funder. So for example, sorry, real quick, Kat. So for example, in that case, like maybe the grant is asking about whether participants have trouble accessing healthcare. Maybe you've never collected that type of data. Maybe you cite a journal article on people who use drugs having difficulty or experiencing stigma accessing traditional healthcare. Now, next slide. Setting the stage for Kelly later. If you are planning to increase or modify your data collection, it's a great opportunity for you guys to think about in advance how you're going to document new services. If you're starting a case management program for the very first time, consider checking in with your staff beforehand about what that would look like, what it would mean, how you're going to define certain services so that when you're applying for the grant, you can be really specific, both to be compelling to the funder and so you can hit the ground running if you receive the grant. And then it's also a great time for you to review your current data collection to make sure that it's all relevant and that you're using all of the data that you collect. Because if you're going to incorporate new requirements, see if you can cut anything else. Yes, next slide. So I'm gonna kind of rush through the next section because it can get kind of dry, I think. But tying your program data in with community level data, so whether that be on social determinants of health, health disparities, or epidemiological data, it's gonna help funders understand what your participant profile looks like in comparison with what community data looks like and help convey the need of your specific program. So just a little further overview of that. Next slide. We recommend choosing data that is as local as possible and most closely matches the size of your catchment area, going back to that program data piece. The most recent, so a lot of regions are able to release data annually. However, it's often towards the end of the following calendar year. And a lot of stuff definitely got messed up during COVID. So we're seeing 2020 data still coming out. And that it is demonstrative of what the grant is looking for. So if you are thinking about showing how you serve folks who are disproportionately impacted by incarceration, you might cite data on incarceration rates and then also cite information about your particular participant population and compare the two. A note on missing data on the next slide. Plenty of municipalities, counties, states vary in what data they make available, either publicly or even what they collect. And this can be based on resources, it can be based on prioritization or what funding they have. So feel free to consult with your health department, try to get a contact, reach out. Some of that data may not be published online, but they could have it internally that they could share out with you as requested. And if they really don't have that data, consider if you could use anything as a proxy. For example, it's really difficult. Most states, regions, et cetera, don't have a count, for example, of people who use drugs in the community. So could you look at indicators like acute HCV infections? Could you look at healthcare utilization, for example, non-fatal overdoses, and so on? Next slide. So on the next 3 slides, sharing a little bit of examples about EPI, social determinants of health, and health disparities. It is important, I think, for programs in their statement of need to use a variety of each of the 3, just because they're very complementary. Next slide. There are a variety of sources available to you. Like we said, it is best to use local sources when possible, but there are some really great federal sources that break things down by state. So for hepatitis C, HIV, and opioid overdose, we've gone ahead and inserted some links for you that will be clickable in the PDF that include state by state breakdowns. And then there's like directories of local sources, which you can find as well. And then if all else fails, try Googling the name of your county along with what you're looking for and see if maybe that'll turn up some results. Next slide. For health disparities and social determinants of health, there are a plethora of options for you to start considering. So some of our wonderful funders that we know and love offer some of this data and make it available. So AMFAR, for example, has this great dashboard that you can click through and stratify data that you could cite. And also SAMHSA does a really great job of putting out reports on social determinants of health, as does the census and American Community Survey. My last note is on citing your data in grant applications. So thank you, Kat. So just look at the grant requirements. Some may include endnotes in the page requirements. So it may not behoove you always to include endnotes because they can take up a lot of space. And instead, some programs may choose to use hyperlinks in parentheses. This isn't best practice for something like research, but a grant application, it's usually fine. But double check the fine print on the RFP. And then just a quick last note before I hand it over to Kat. A reminder that you can use data to communicate your program's impact and reach, describe the community need, and justify your proposed activities. Thank you, everyone.
Great, thanks, Sarah. So next, we're going to focus more on the program or project evaluation part of grant writing. And there are basically three overarching themes that I'm going to cover today that really relate to all parts of designing your project evaluation. The first is starting with your grant requirements. And that's really just about making sure you give the funder the information they're asking for. The second is making sure to develop it in conjunction with your project plan, and really making sure that the project and evaluation plan are aligned. And then the third is about considering your program, your organization's broader data and evaluation activities and needs. And these three themes, really, are geared to do two things. The first is, setting you up to make sure that you have a competitive, successful application. But it's also about making sure that if you're funded, you can make implementing the evaluation part of your project as easy as possible and as useful for your program as possible. So really making sure that the evaluation plan is aligned with the work you'd already be conducting, for example, as part of the project or as part of your broader organizational data collection and evaluation activities. So diving into the first one, it may seem obvious, but one of the most important things about drafting an evaluation plan for a grant is making sure you're giving the funder the information they want in the format they want it. So at the end of the day, they're going to be scoring your application based on the requirements included in the funding opportunity. You can have the best project plan and evaluation plan that would have, the most incredible impact. But if you don't, really meet the requirements they're asking for, and if you don't design your evaluation plan in response to those requirements and in response to the selection criteria, then you won't get selected and funded. And, anyone who's been on review committees has had this experience where they'll read a grant and they'll be like, this is great, this could be such a great project, but we have to stick to the selection criteria. That's the fair and the fair and required thing to do. And sometimes you can't fund organizations that have great plans because they didn't meet those grant requirements. So as obvious as it seems, it's really important to make sure to ground yourself in those grant requirements first. And then in addition to giving them the information that they're asking for, It's also really important to make sure that you use like the format or the terminology that they ask for. So if they, want it in a narrative, a few paragraphs, do it that way. If they want a table or a certain type of format, make sure to do that as well. And in a few minutes, I'll go over some comment formats. But essentially, just be very literal when developing your evaluation plan. Look at exactly what the funder's asking for, and really try to meet that. And honestly, it'll also just make it easier for you because you'll have, guidance to tell you exactly what you need to do. Unfortunately, this information, the information you need to write a strong evaluation plan, can sometimes be sort of scattered throughout the grant. But I've put some sections on the screen where you can usually find this information, and it's sort of like ranked in order of importance. So the exact sort of like sections of a grant might have different names, but generally the two most important parts for this are going to be your application or submission instructions, and then the selection criteria. So the application or submission instructions, that will cover, what information you're supposed to include in your evaluation plan and how they want you to provide it. So for example, the format. And then the selection criteria will tell you how they plan to score it. And that varies depending on the grant, but some common ways that it might be scored are based on the clarity or specificity of your plan. And I will say that's, just across the board, the more clear your grant is, the stronger it's gonna be. Feasibility. So, feasibility, we talk a lot about, the feasibility of your project, but it's also important that your funder, believes, okay, they can actually implement this evaluation plan. And then of course, making sure it's really connected to the goals of the project and project plan. And we'll chat about that a bit more in a few minutes. So those are really the two core sections, but you'll also, want to make sure that you revisit some other sections as you draft or as you finalize your evaluation plan. In particular, the background section or a goals and objectives section, that will, remind you of what the overarching goals of the grant are. And that's important because the evaluation plan is all about demonstrating that you're achieving the goals. And then finally, whatever part of the grant they describe the project itself. So it's often called the approach or maybe activities. That's also really important because often the evaluation and the project plan are really interconnected. So they might, for example, want you to describe how you'll do the evaluation in the work plan. Or there might be, deliverables and activities in the project plan that you have to include in the evaluation plan. So you'll also, really make sure you want to be aligning those two. And I do want to caveat that, as Sarah said, same goes for here. There's a lot of text on some of these slides. Really want to make sure that the slides themselves are a resource. But, feel free to, depending on whether you're a verbal or auditory learner, do a mix of, listening and reading. So wanted to talk about some key terminology for the next few slides. And, I will say the exact sort of definitions and scope of these terms will vary depending on the grant. So you'll, of course, once again, want to really ground yourself in what the grant asks for. But the definitions I've included on the next few slides are general enough that they should give you a solid framework for sort of navigating the language of evaluation. So monitoring and evaluation are two terms that are often used together, and they are really interconnected. Monitoring, though, tends to be about tracking the project in real time. And so there are two sort of components of this. You can be monitoring implementation, and so that's monitoring the project. Like, are we implementing the project as planned? So for example, in your project plan, you might say you want to start distributing safer smoking kits by May 1st. And so part of monitoring would be like, okay, did we actually start distributing safer smoking kits by May 1st? But monitoring can also include a bit of looking at the impact. Obviously, when you're just getting started, it's hard to see if you're having an impact, but it can give you sort of like an early warning sign or indicator as to how it's going. So for example, if by the end of the year, you want to increase your client base by 50%. Then monitoring might see, how you're doing after 3 months and after 6 months and whether you're on track. So monitoring can look at both implementation and impact, The scope of that will really depend on the grant, but it usually is about, making sure things are on track, and, often getting sort of early insight into the impact. Evaluation, the evaluation part of monitoring evaluation tends to focus more on the impact. So was the project successful? Did we meet our goals and objectives? And so a lot of the work in terms of sort of like analyzing the evaluation and getting those findings, a lot of that tends to happen at the end of a project, but you'll be doing activities throughout to collect data. So the evaluation activities are sort of ongoing, even though a lot of the more like analytical work is at the end of the project. Two other key terms to sort of frame evaluation broadly are process evaluation and outcome evaluation. And process is really about evaluating the process. So are you implementing the project as planned? Whereas outcome evaluation is really about the outcomes of the project. So are you seeing an impact? And once again, how much you have to spend on these two things, process versus outcome, in your grant is really just going to depend on the funder. But these are, really important ways to sort of frame the overall evaluation plan. So this next slide has some more terminology. These really cut across both like the project implementation and then the evaluation. And so these are terms that sort of tend to describe the impact or the outcomes of the work. And once again, the exact definitions will vary depending on the funder. But what I've described on the screen here, and we'll go through out loud in a second, does tend to be pretty consistent across funding opportunities. So generally speaking, goals tend to be really broad and they focus on the impact. This is, not a rule by any means, but a lot of goals start with words like improve or increase or decrease. And so often these are, sort of like high level, what you hope to see. And sometimes they might be, very long term and things you won't actually see during the project. Strategies also tend to be broad, but they describe the actions. And so they usually start with an action verb. So for example, establishing linkages to care might be one strategy. Objectives tend to be much more specific. So these really cut across the actions and the impact, and they describe the major project successes or deliverables. And I know some of you might have heard the term SMART objectives. I won't go into that too much now because what's required for an objective depends on the funder. But generally, objectives are really specific. That's what the S in SMART stands for. They're supposed to be measurable. So you're supposed to be able to say down the road, like definitively, did we achieve this? They should be achievable. So, realistically, you can achieve that within your project period. And they're supposed to be time bound. So there's often an end date. So for example, implement X by date. And then activities tend to be more discrete actions. These are sort of the smaller medium tasks that help you achieve your objectives. Last terminology slide, outputs and deliverables. These can technically be used interchangeably. They both describe specific achievements of your project and often refer to like tangible products. So something you could, like actually submit to your funder. And some grants might require one or the other or both. But even though technically they describe the same thing and can be used interchangeably, generally deliverables tend to be like bigger accomplishments, whereas outputs tend to be smaller ones. So for example, if you are planning this big meeting to, inform your work, the final deliverable might be a report synthesizing the findings of the meeting and outlining, changes you're going to make as a result of the meeting. Whereas the outputs might be like the meeting agenda, the list of meeting participants, the meeting slides. So they tend to be, really tangible products, and outputs tend to be, sort of smaller, relate to activities, whereas deliverables tend to be larger and relate to objectives. And then the outcomes describe the impact of the work. And depending on the funder and their requirements, they might be broken down into short-term, medium-term, or intermediate and long-term. And so I have a few examples on the screen. A short-term outcome might be increased access to safe injection equipment. Medium term might be decreased needle sharing as a result of that. And then the long-term outcome you'd want to see from that work might be decreased transmission of HIV and hepatitis. So before moving on for the terminology, just want to reiterate, the exact terms and how a funder sort of defines them might vary slightly, but having an understanding, this general understanding of the language should give you a pretty solid framework for sort of navigating what kind of language they might use and what they might expect you to use and provide. So there are a couple common formats that funders might require when asking you to develop an evaluation plan. And I've listed these on the screen, and we'll go through them a bit more in depth in a second. Excuse me, I have a bit of a sore throat. So the first is a logic model. And this is a visual representation of how the resources that you have, including the funding, the activities, and then the outcomes all relate to each other. The evaluation plan or framework describes what you hope to learn through the evaluation and then how you'll learn it. So really, sort of the nuts and bolts of how the evaluation will occur. And then narrative is just, providing some more details in a paragraph format. And often you might have to provide both. So you might have to, provide an evaluation plan, but then also describe your evaluation in a paragraph. So on the screen, I have an example of what sort of a common logic model framework looks like. And as you can see, usually you'll be asked to describe your inputs, and that's sort of like all the resources you need to achieve the project. Logic models also often require you to detail your activities and then the outputs of those activities, as well as the short, intermediate, and long-term outcomes. And once again, the exact format of the logic model may vary depending on the funder, but this is sort of a pretty standard one. And so here is an example, and I do want to flag that I borrowed this great example from the Oregon Health Authority as referenced. But as an example, the inputs might include the dollar amount that you'll need for the project, the number and breakdown of staff and volunteers and peers, the specific materials, and then the partnerships. The activities might be things like implementing syringe distribution through outreach, or implementing HIV and hepatitis testing referral processes. Sorry, just taking a lozenge real quick because of my sore throat. Outputs might be like the specific impact you see, so syringes distributed, clients referred. And then over on the right of the screen, those short and intermediate and long-term outcomes are the same as what I included a few slides ago, but basically short-term might be increased access, intermediate might be decreased syringe sharing and reuse, and long-term might be decreased HIV and hepatitis transmission. Another common format is an evaluation plan. And so there's, once again, a lot of different ways this might look, but generally you include an evaluation question. And that's sort of like what you want to answer about through this evaluation. Then you have the indicators, and those are the specific metrics that you'll use to answer that evaluation question. And then finally, the data sources. Sorry, we're just gonna have to go slow with my sore throat. I will say something I really appreciate about teleworking through the pandemic is it can be very humanizing because people have their dogs barking or have to deal with like life things like a sore throat on a webinar. So I appreciate you all staying with me here. So on the screen, I have a few examples of evaluation questions, indicators, and data sources. I won't go through all of these, but an example might be if you want to answer that second question, does our mobile van enable us to reach new clients? Your indicator might be the number of new clients enrolled via the mobile van services. And your data source might be your intake form that's programmed into a specific software. So this might be the kind of information that a funder would want in your evaluation plan. Other common information to include, depending on the grant requirements, is timeline, roles and responsibilities, and then specific information on data sources. And things that are commonly included here are, do you already have this data? Do you need to start collecting it? Do you need to get it from a partner? And then do you have baseline data to compare it to? So I'm going to take a pause while I take a sip of water and to give you all a second to process. Okay, so next theme is connecting your evaluation plan to your project plan. So ideally, you should be designing your evaluation and your project plan at the same time. In reality, a lot of times you either already have a sense of what you want to do, and then you need to, think about how to evaluate it, or the funder might be really clear on what activities they want you to implement. And so then you have to think about, okay, so what are we going to learn from this? So ideally, these should be developed together from the beginning. But a lot of times you already have a sense of what you want to do. And then you have to help yourself think through goals, objectives, deliverables, and activities. I'm sorry. Kelly, do you mind if we skip forward to your slides? Give my throat like.
Yeah, I was going to offer, but I don't want to interrupt
Sorry. Okay, so let me go forward a bit. Thanks everyone for bearing with us.
you. You could get me to 49. Yeah, there we are. Great. Thank you. Hey folks. Okay, I'm Kelly, and I'm going to quickly discuss a little bit about data systems and data reporting requirements, budgeting, and a tiny bit about software systems. And so the first thing I want to talk about to just start us off is evaluating if you can meet the reporting requirements of the grant. And to get us all on the same page, I'm going to get a little bit into some terminology around duplicate versus unique data. So I'm not going to talk about point in time survey data for this, but it fits into this conversation as well. So the most SSPs use either duplicate or unique data for their encounter data systems. Duplicate data is when clients are not assigned a unique ID and you're really tracking encounters. So if someone comes in, you track like syringes in, syringes out, but you don't have a client ID. So you can't deduplicate your data, and it's difficult, like near impossible, depending on, to estimate how many unique clients are served. In unique data, your clients are assigned a unique ID code. So when they come in, you like get their unique ID code, then you syringes in, syringes out, et cetera. And that means that when you have your data set, you can use that code to deduplicate your data and estimate the number of unique clients you serve. And there are benefits and challenges to both kinds of systems. One is not better than the other. Overall, it just depends on, there's a lot of considerations depending on what kind of services you offer, like if there's specific reporting requirements based on your policy or state. So most folks fit into one of those two, but next slide, Kat. So when you're trying to evaluate, like, can you meet the grants reporting requirements with your current data system? It's a really important question to ask, because if you can't, then you really have to, as Sarah said earlier, do some soul searching. So do you currently collect the data to meet the reporting requirements? And a first part of that is, are the reporting requirements based on unique clients or encounters, or sometimes estimates, I would say. So this isn't always upfront information in a grant. Often it's not explicit. It's something you kind of have to look for in like reviewing the metrics that they ask for. You can also reach out and ask. But an example would be, if one of the metrics is the number of unique clients served, you will need a unique data system to report that data point, unless they would accept an estimate. So if you have a duplicate data system, your options in that place are really to, reach out and ask if they're accepting estimates, or you would have to change your data system in order to meet that. And I'll get into a little bit thinking about, like, is it worth it? And I want to note some organizations might collect both unique and duplicate data. So an example would be like your organization and you have multiple services. For your SSP services, you have encounter data system, so no unique ID. But once folks engage in higher level services like case management or something else, then they get assigned a unique ID. So in that case, you might actually have both a duplicate and a unique data system. But it's really important to figure out what pieces the grant requires and if you can meet them. And like another aspect of this is like, based on your raw data, does the grant require significant analysis for you to do the reporting? How hard is it for you to pull those numbers and then analyze them? And these questions really impact the budgeting for your project and the staffing. If it's really burdensome to collect that data and you have to do it very often, that's going to impact the staff time needed to do that. Next slide, please. So if you don't meet the reporting requirements that the grant has, and it requires a significant change, there's a lot to consider. Some examples of a significant change might be that you're changing from a paper system to a digital data collection system. You're like starting a new or switching to a new software data collection system. You're changing from duplicate, so no client ID, to a unique system where you do have a client ID, or you're adding a significant number of new data. So just a significant number of new data collection points, or even just like significant in terms of maybe their how intense they are to ask clients around what kind of data points they are. And all of those are a really big effort. And it's important to really evaluate if it's worth it and if the grant provides enough funding. Like, what would it take for you to get there? And is there enough funding in the budget of the grant to cover it? For a lot of these, you're going to need you're going to need a project lead, and it's going to take a significant amount of their time. For a lot of them, at some point, it's going to bring in a ton of people from your organization, especially if you're going to have to do training or like really rehauling different aspects of how you provide services. So for example, if you're setting up a new software, that likely involves training everyone who does frontline services on the new data collection system, kind of getting clients ready to see, like maybe there's like different questions that they're going to be asked, or people are now using an iPad to collect data instead of paper. So there's a lot of steps in that, a lot of people involved, and it can take a long time. I think a lot of these things can take many months to set up. So also important to consider, like, do you have the lead time to get them up and running? And you get the grant and then you start it, are you able to meet the first reporting requirements in the time you have? So just really evaluate, as I think Sarah said it best, soul searching about like, is it worth it? And if it's for one small grant and a small amount of money, it might not be, versus if like it's something that would allow you to access a whole new slew of grants with a lot more money. Maybe a change is more worth it and something that can be planned out moving forward. Next slide, please. And so when you're budgeting for monitoring, evaluation, time, and effort, there's kind of like two big buckets to consider. And one is staff time and one is like software and hardware. And for staff time, I think it's important to consider, there's a lot of pieces that go into the data aspect. So it's like data entry, database management and cleaning, data analysis, reporting. And so really thinking about all that different staff time that's going to be included and considering that in your budget. Are you going to have to hire new staff as part of this that are going to have to do, are the new staff going to have more data entry to do, or do you need someone who can do the analysis because currently you don't have someone who has that responsibility? So I think really making sure there's enough effort in the budget to make sure folks are covered for all the work it'll take. And for software and hardware, it's really different across different organizations, but considering like how you'll add in your current software costs and any hardware costs, and then like thinking about how that increases or scales with new people, or new technologies, right? Like some softwares include a cost per user per software, or per license, right? So if you're adding new staff, making sure there's a line item for all of those new staff to have their software covered, or like a portion of each license for each staff who touches the system. Are you going to need additional or hardware or software for the project? So considering, those two big buckets when you're thinking about the budgeting. And if you move me one more forwards, Kat, next slide is the way. So for an example, often staff time is going to be the largest part of your M&E budget. NACHO and our team worked on 3 funding opportunities last year, and this is an analysis of the funded SSP's budgets. So these funding projects were all monitoring evaluation, and as you can see, the majority of people's budget was on staff time, because it takes a lot of time and a lot of effort to collect that data, analyze it, and implement it across these things. So I think it might be more staff time in your budget than you're considering. Next slide, please. And I'm going to very quickly talk about software options. Sarah and my team and Kat were part of the National Harm Reduction TA Center. I'll drop a link to the TA Center in the chat in a second, but if you're considering something, you're welcome to reach out to us and we can talk more about it. But when you're choosing a software system, there's like a lot to consider. Like, what is a reasonable budget that you can spread across your funding? How secure do you need a data system to be? Does it need to be HIPAA compliant? What kind of like control options do you need? What does it need to interact with? What are the other software systems or reporting systems you need it to talk to? Does it do data analysis? Will you need additional analysis software and options? And next slide. I've listed here a lot of common M&E software that folks use, and there's a lot more to talk about with it, and I just don't want to take too much of our time today focusing on it. So I've got a couple here. As we said, the slides will be available afterwards and we can talk about, please reach out if you have other questions about this. And Kat, I'll pass it back to you if you're feeling better. How you doing?
Yeah. Thanks everyone for your flexibility. I just took like so many lozenges and lots of sips of water. So hopefully I am good now. Okay. So back to the evaluation plan. It's really important to connect it to your project plan. Once again, may seem obvious. Sometimes people who don't work in public health, I tell them that a lot of public health seems obvious after the fact. It seems like common sense. But you have to, listen to the populations and understand the work to get to that point of it being common sense, right? So it's really important to ground your evaluation plan to your project plan. And on the screen, I've included some key questions that would help you develop your evaluation plan based on your project or work plan. So a big one is just, looking at your goals, your deliverables, your activities, and asking yourself, how will you know when you've achieved these? And then diving into specific indicators and data sources. First thing you want to ask yourself is, what data do you already collect that could demonstrate, that you've achieved these goals? If you already have this data, it will make it easier to implement the evaluation. It'll also demonstrate to the funder that your evaluation plan is feasible. You already have the data, you could absolutely implement your evaluation plan. If you have to collect new data, once again, you want to make it as easy as possible on your staff. So think about how you can easily start collecting it as part of the project, for example. And then you also want to think about what data could we collect that would be appropriate for this grant, but that could be more useful for our program beyond this grant. So at the end of the day, it can be really challenging, but as much as possible, you want to avoid collecting data that's only useful for one specific grant and for one specific funder. And so, just to sort of reiterate, you want to make data collection and evaluation as easy and as low burden on your staff, and then as useful as possible to your organization. So on this slide, I included some prompts that essentially help you do that. Determine what indicators and data sources you can use based on what data you already collect and what data would be useful for you. So for example, depending on what the grant says, if it talks about improving access to health services, you might want to consider what unmet needs your clients have, what health services are hard to access in your community. For your evaluation plan, you might want to consider what data do you already have on client health trends. Do your partners have certain data, for example, the health department, that you could potentially access? And then, thinking about, if you need to start collecting this data, well, it'd be really easy to collect while implementing the project. So having staff record the number of referrals they make might be easier than getting that data from partners. This slide includes some more details, some more prompts on how to identify what data you could collect for this grant that would also be useful to your broader program. So I won't read all of them. These will be sent out to everyone afterwards. But in terms of thinking about what data you might want to start collecting for your grant, they could be more useful. You might want to consider, what do you want to know about your clients? Or what data would help you convince the funder to continue to support this work after the grant? Or convince another funder to support this work once the grant is over? Or what data might be compelling to your partners, to local policymakers, or to share back with your clients? So there's a number of questions on the screen that can help you think about, if we have to collect new data, what kind of data might we want? And finally, I'm going to survive one more slide. The key takeaways here: focus on the grant requirements, make sure to align your evaluation plan with your project plan, and then consider how your project evaluation can benefit your program more broadly. And then I believe, am I turning it back over to the SHARP team or to AIDS United?
Yeah, I think we're ready for questions. So hopefully there's a combination of the AIDS United folks and us. I'm just gonna drop the.
Yeah, sure. I can go ahead and interject. I wanted to say thank y'all for this lovely presentation today. We do have one, and folks, feel free to ask questions in the chat. We do have one question from someone in the Q&A section here that wrote, what are some good evaluation activities to conduct during a project?
So I would say it really depends on your project goals, but common evaluation activities to conduct during the project are really just all the different data collection activities you might do generally or at the end of a project, but you do it throughout to sort of give you an early sense. So if you want to see, like, sorry, I'm just going to type a response, but Kelly or Sarah, feel free to jump in.
I was going to expand on the example you provided earlier, in terms of, and I think some of it might be like, maybe an evaluation activity is actually like more around what data are you looking at, seeing how it's going. So your example of like, is your mobile van reaching new clients? So you could have something to look at while what's going on is like, right, setting up your data system in a way that you can look like monthly, how many new clients are you getting through your mobile van? And kind of understanding like, okay, is the mobile van getting new clients? And if it's not, and your goal is to get new clients through the mobile van, like what's going on? Are you not going to the right spaces? I think sometimes it leads to other questions. So like, are you not going to the right places? Do folks not know about it? Do you need to like get the word out more in order to see those numbers go up? So I think that would be like an example of something that you could do during a project that helps inform what you do to keep that going. And then like the end result at the end would be your outcome might be how many new projects or how many new people came to the van. Hopefully Kat agrees with me in her typed answer.
Sarah, would you like to chime in, or should I transition it to another key question?
Yeah, I mean, I was just gonna say real quick to Kelly's point about like, are you enrolling new folks at that site? Again, just bringing in that comparison point. So if you have like previous mobile site data, like how does this compare to before? And then if you're not reaching those things, like Kelly mentioned a few questions that you could ask yourselves, but you can also ask participants, right? So like, are we in the right place? And like, maybe it's like a 2-question point in time survey where you ask everyone who comes for 1 week to that mobile site, like, you know, about the location and placement of it. And that could be something that you use for grant reporting. Maybe it's not part of your, maybe it's like a responsive part of your evaluation plan.
Thank you. Another question that we received was, Sarah mentioned the use of anecdotal data. How would you present that to potential funders?
That's a great question. So a lot of times the anecdotal piece where it might not be like as hard data fits in kind of like an organizational overview or a grant, like a narrative grant report most seamlessly, right? So like, these are our services. Here's a couple of comments that we've received, right? And here's like representative comments. And you could collect those like through something like a suggestion box. I've definitely seen programs that are maybe a little bit more medical do something like a satisfaction survey based on a visit. And then you would definitely want to ask permission to use that quote and be careful not to include identifying information in it. And then in narrative grant reports, a lot of times I think funders can be really interested in what you have to say about like how things are going. And anecdotes can be really powerful there. And I think that that's the type of thing that might draw your funder in to be like, wow, what you're doing is really innovative or impactful. And like, here's how we stay involved in this grant recipients program in an ongoing way. There can be some important uses for anecdotal data in the statement of need as well, especially if you're collecting something in a maybe slightly more formal way about like, let's say you do a point in time survey and you're getting qualitative or free text responses about how participants view current services or needed services in the community. And you could provide some like representative quotes in that case, in addition to kind of like a quantitative summary of your findings.
I was just going to add, I think like whenever you're presenting kind of anecdotal evidence, and Sarah said this in her presentation earlier, part of it is just like making it clear that that's like where that data is coming from. So like if it's something a client has said, right? It's like saying clients say, or a client, we heard from a client. And it could also be, depending on the method, I think it can be helpful for folks to know what the source of that is. So if it's like a comment box, right? Or like a comment to staffers or just to staff, or like if it's like if you run, some people run like kind of a qualitative point in time survey where like maybe you ask all your clients the same question over a 2-week period. So just mentioning whatever the data source for that is. And if it's like direct from a client, if it's like filtered through a staff person, et cetera, et cetera.
Thank you, Kelly and Sarah. Do we have any other questions for our panelists, for our presenters? I'm looking through the chat. I don't see any questions. Folks, feel free to, you can. I don't see any questions in the chat at all, and that is totally fine. I see folks rather just affirming you all. Again, this has been really insightful, really informative. And so I just want to say thank you for taking time out of your day to present on this information. For participants here today on the webinar, feel free, if you do have any questions, to reach out to the respective contacts here. The SHARP team can be found at sharpta at uw.edu. In order to request assistance from folks here, you can click the link here at harmreductionhelp.cdc.gov. And then for Kat's email, it's kkelly@nacho.org. And again, this all will go out to you all first thing tomorrow morning. You all will get the PDF version of the slides, as well as the recording for this webinar, an evaluation form for feedback, and other resources that were discussed in this presentation. If you have any questions, feel free to reach out to either of us and we will be of assistance. Other than that, I hope you all have a lovely Wednesday. Take care of yourselves. Thank you.
Thanks, everyone.